What's the best way to deal with hammer toes on your foot? That's what we're going to look at this week with Healthy Living. So I want to go over this presentation that I give to all my patients about hammer toes. What are hammer toes to start? Well, basically they're toes that kind of look like hammers, or not really. They could be a claw toe, it could be a mallet toe, it could be a hammer toe. But a lot of people get confused. They're really not that complex. Basically, it's one of your toes that curves. And I'm going to make it real simple today, kind of talking about which ones need surgery, which ones don't need surgery, and what are the treatment options for you. So stick around with me over the next few minutes. So what are hammer toes? Basically, they are curving of the toes. You can see here, this is the big toe joint. Okay, the metatarsophalangeal joint, not on the big toe, but on the fifth toe. And this one curves and causes a hammer toe. Now, as you can see, it's on the outside of the foot. This tends to be problematic in your shoes. Here is another type of a hammer toe right here. So due to the bunion moves over, hammer toe goes up, hammer toe goes over the second toe. You can't just fix the hammer toe. Everyone asks me, can you just fix the hammer toe? No, you have to fix the bunion with the hammer toe. Do all hammer toes need to be fixed? No, they do not. Another example of a hammer toe, this one. Well, with a hammer toe, there's always something called retrograde force, basically the force of either the shoe hitting down or the toe going back. So many people with hammer toe pain have metatarsophalangeal joint pain, basically pain in the middle of the foot or a stress fracture due to the hammer toe. So let's go a little bit more into it. What are the causes? If you want to get really technical, the simplest way is mechanical instability, an unstable foot or tendon pulling harder on one side or the other. My favorite, biggest culprit is narrow shoes, basically shoes that are too narrow, causing the toes to kind of pull in different directions. And then if you want some technical terms, one is called flexor stabilization. When you have a flat foot, you stabilize or flex your toes down. This can also be seen in people that have shoes that are slip-ons. They flex down to stabilize them. And then the last one, which isn't all that common because it's seen in a high-arched foot or a tight calf foot, which is called equinus, extensor substitution. So these are people when they walk, the toes kind of go up as they're walking. Now, how long have you had symptoms? This is a key factor. If you've had hammer toes your whole life, greater than 3 months, it's going to take you a long time to get better. If it's been less than 3 months, that's not all that common with hammer toes. What other treatments have you tried? These are things I ask my patients. Have you tried changing your shoes, pads, or supports, or other inserts? And then the most important thing when you're talking about hammer toes are not really all that dangerous if they don't cause pain. So if there's no pain, you don't have to do anything. If they cause pain from rubbing or callousing, most likely you're going to focus on shoe changes. If you have pain to the ball of the foot, you can try different types of pads or inserts. If you have a wound, that's dangerous. Okay, wounds are dangerous. Wounds would be a reason to do a surgery potentially. If you can't be as active, it might be because of shoe gear. Okay, and if you can't find comfortable shoes, might be because you're not choosing the right shoes.